What is recovery for closed preservation rhinoplasty? We will typically group this into a surgical recovery as well as a cosmetic recovery. There are 3 total phases of wound healing. There are 2 weeks, 2 months, and 2 years. And 2 weeks is generally when you're done your surgical recovery. This means that unnatural swelling, unnatural bruising would have dissipated by now, and you can return to normal activities or work without most people noticing. Your nose will be swollen, it certainly will not be fully healed at this point, but it'll look like a normal nose. 2 months is when we start to appreciate the cosmetic change of the nose. This is when about 50% of the swelling has dissipated, and we're starting to recognize a little bit of definition, certainly a little bit more highlight and contour to the nose. This also follows the breathing. And so people will notice that they have better breathing days than worse breathing days at this point. And most patients are happy at the 2-month mark. However, depending on your skin thickness, your age, your general health condition, it can take up to 2 years to see the final results from any type of rhinoplasty, preservation included. And this is typically when people will notice that their nose is breathing better, their swelling periods are definitely much more consistent, the sensation of the nose is better, and the function of the nose, which is to provide humidity, is also much better. During your recovery at home after rhinoplasty surgery, you're going to want to set up a side table with all of the supplies needed to ensure your best recovery possible. We have 3 major goals after rhinoplasty surgery. The first one being to clean out the nose with the nasal splints. The second one being to clean the incisions as best as possible. And the third one is to prevent swelling as much as we can. The first step in cleaning out the nasal splints, which look like this. So they're specially designed silicone splints that actually have holes inside of them to allow you to breathe. You will not see these splints during your recovery process. The idea of the splints is to actually hold the septum in place and to sandwich it to ensure a much better breathing and a much faster breathing after your rhinoplasty surgery. So in order to keep these as clean and open as possible to maximize your comfort during recovery, the first step is going to be to use your nasal saline rinse. This rinse, once added to the salt and distilled water, can be used in one of 2 ways. So you're going to actually place it inside your nose and hover over the sink once you have your mix actually prepared. And the goal is, of course, to clean out the splints as much as possible. If you're able to breathe well, you may not have to spray to the point where it comes out the other side. All you're going to want to do is moisten your nose to the best of your ability. Now, every so often, a patient really can't tolerate the saline rinse. Either the water gets stuck or the pressure really bothers them. So what you may want to use instead is something like this, which is a sparkling seawater saline mist, or any type of flow that allows you to maintain hydration. Now, that may not effectively clean the blood out from the splints themselves, but at least it's keeping the nose as moist as possible. So step number 1 is nasal spray. Step number 2 is cleaning the incisions. So we have a mix of peroxide with a little bit of clean water that you're going to want to place inside a cup, and you'll have a Q-tip available. The goal of cleaning the incisions after surgery is number 1, to debride or clean off any residue from the surgery itself. That may be either inside the nostrils or at the incision lines if you've had an open rhinoplasty or an alar base reduction. And then after you've cleaned off those incision lines with a little bit of peroxide, you'll just take regular water to clean off the peroxide itself. We don't want dry blood to accumulate over wherever you see stitches because the incision lines may not heal as well. And then the second step to providing a great incision care to your wounds is to apply a moisture barrier. We tend to use Vaseline in our clinic. And again, you're going to take your Q-tip, dip it into the Vaseline, and apply that to the clean suture line to maximize your recovery. So then step number 3 is to minimize swelling as best as you can. Now, of course, we take every measure possible during surgery to ensure your recovery and comfort. However, you still will experience swelling and potentially some bruising after surgery. And the only way to prevent that or to minimize it as much as possible is to ice as effectively as you can. So you're going to have a bag of peas or an ice pack like this, and starting the day after surgery, you're going to want to place it on your forehead, right on top of the cast itself, on each of your cheeks, as well as your chin. And you're going to be doing that for about 20 minutes at the top of every hour for the first 3 days. Many patients will ask what they can do to expedite their recovery after surgery, and while time really is the best cure to all things swelling, bruising, and aesthetic involved, you can consider taping your nose at night. The reason why we don't always recommend it is sometimes the tape can really irritate the nose and interfere with recovery. So if you really wanted to tape your nose at night, this is what we would recommend. So you buy MedPore tape, you can buy this at any pharmacy. It's micropore, so it allows your nose to actually breathe well. What you're gonna do is remember the 3-2-1 rule. So you're gonna take 3 pieces of what we consider to be a small length. So that's 1, 2, 3. You're gonna then get 2 medium pieces of tape. 1, 2. And then you're gonna do 1 longer piece of tape. So 3 small, 2 medium, and 1 large. For the large piece of tape right in the middle, you're gonna wanna create a little etch or a little hash mark, and that will allow you to bend it around the nose. There are 3 common areas of your nose that may actually have substantial swelling after surgery. That's the tip, the top of the nasal bridge, as well as the nasal sidewalls. So what we're gonna try to do with the tape is to compress that pressure down so that it gets distributed laterally into the cheeks themselves. So the first piece of tape you're gonna apply right up top, and then you're gonna very gently make your way downwards. You don't need to apply a lot of pressure or tension towards the tape itself. It'll do the work for itself. So your large piece of tape is really gonna hug the tip of the nose and try to distribute the swelling from the infratip region. So you're gonna hug the base of your nose, make sure you get along the lateral side walls and up towards the corners of your eyes. Once you've done that, you can pinch it a little bit and you can see that little hash mark relieves a bit of pressure there. So then you're gonna start to go up. So we have 1 more piece of medium tape that we can apply, and that's going to go right along the top of the supratip region, really compressing down the tip itself. And then we have 1 more small piece of tape that then goes on top here. So that's it for nasal taping. Obviously, it's not an exact science, but the idea is really to get rid of swelling along the top, the sides, as well as the nasal tip. And as part of every surgery that we perform here at Yorkville Plastic Surgery Center, you're gonna receive a care package with a bunch of goodies, but most importantly, your actual checklist. So if there's any questions or problems, we're always available to answer your questions, but much of that is actually written inside that checklist, which has been created from our experience with many patients over the many years.